Hey guys, we've got a new exercise for you guys to do today, Williams Flexion Exercises. So a lot of times we look at the back and we know about like back injuries with regards to your lumbar discs or your muscles, but one of the things that we kind of look at is the facet joints, which that's actually what we're adjusting whenever we're treating patients, is we're getting the motion segments in each one of your spine segments to actually keep moving. And so the Williams Flexion Exercises are great whenever you have lower back pain that seems to hurt whenever you're kind of coming backwards this way, and it's just causing more impaction and everything that you're feeling in that back. Sometimes it's just local, but it's usually sharp and pretty intense when you feel it. So this is going to be a great exercise for everybody to kind of use to be able to get through this if you feel like it's kind of a little bit off and before you can get to your next appointment. So I'm going to start today. It's broken down into a couple different segments based off the severity where you're at. So where we always start patients is whenever they're laying flat like this, bringing their legs down at their side, or completely flat and stretched out. And what you're going to do is bring one knee towards your chest like so. So from this point, you are getting a little bit of flexion to be induced into the actual back itself by moving that pelvis. You're going to hold this stretch for about 15 seconds or so, just enough to kind of start feeling the muscles relax. Most of it you should feel in this area, right through the glutes and everything else. We want to stretch those as well. We hold this for 15 seconds, and then we're going to switch legs, come back the opposite side. So we start here whenever we're really, really bad, but even if you're not in extreme pain, this is a good place to start to just kind of loosen everything up. Once you get both sides done, you're going to bring double knees to chest. Hold it just like this, and you're going to feel a lot more stretch to start to happen in that lower back. The double knees to chest is a great exercise, and so we're just kind of getting through the series right here. When you feel like that's kind of rocked out for about 15 seconds, you're going to sit up, stretch out this way, and then using your core, you're going to bend at the waist as much as you can and bend forward. Now this may be the kind of line that you draw depending on the severity of the pain. If you're in really bad symptoms right there, you may not be able to go much beyond this. Again, if this is causing more pain, you want to step back, and we may have to go the other way and stretch opposite way. Check out your McKenzie extension exercises if that's what's going on. So as we're getting that back to loosen up this way, we're getting more and more motion in those vertebral segments. So the next progression that we come to, we're coming to a seated position. This is a little bit high for me, but you can see what we're doing. You're going to slowly start to hip hinge and move downwards towards the ground, leaving it in this position, and then slowly starting to walk back. What I would suggest is waiting about 15 seconds in each position, so that way you're getting plenty of time for you to get to that spot, allow your back to readjust to there and those muscles to lengthen. It may require you to do multiple reps at that same location before you move on to the next progression. So kind of play with it, see what actually is working for you in that motion or in that moment. But yeah, these are great exercises. We really want you to kind of be able to use this if you ever have a hot low back or it's on the weekend, you can't get in, but this is a good thing for you to have in your tool in your tool basket. So check out some of our other stretch videos and see if you can do some of those today too. All right, take care.